this is Grace Jeff from the creator of Navigating the Maze of Mental Health Care. And I just wanted to make a video for you today to kind of explain the more serious forms of treatment. In the previous lesson, we talked about personal therapy, kind of outpatient therapy, family therapy, marriage counseling, and things like that. And that's awesome if you kind of need, once a week, twice a week, multiple times, you kind of come up with that number with your therapist of times to come and talk about it, and you need support and things like that. There are other kinds of therapy and there are mental health care that are important, and I just wanted to touch on those for a little bit because they are kind of more complex. So the first kind is an inpatient at a psychiatric hospital. And that kind of sounds a little scary. The first thing that comes to mind is an asylum or some kind of crazy person, which it isn't the case. And so I wanted to kind of clarify that a little bit more. So when people are admitted to a psychiatric hospital, a psychiatric ward, it is because they're in a state of distress. They're not safe at the moment, whether it be at home if someone is suicidal in an intense manic or depressive episode, if they're in some kind of drug-induced psychosis or this weird state where they don't have necessarily control over themselves, then they're going to be put in a psychiatric ward where they can be in a safe place under constant supervision until that passes. Now, they don't have to heal completely. This isn't a long-term treatment thing. It's more of a band-aid. And what this does is it gives a stable environment where there is a therapist assigned to each client and a psychiatrist overall. So they'll meet with the psychiatrist, and the psychiatrist will kind of listen to them, talk to them. They'll have some paperwork to fill out to kind of get a sense of the symptoms going on, and the psychiatrist will be able to better guide and direct towards a diagnosis. So different kinds of treatment can then be prescribed. And with the therapist, they'll meet together with the client as well as the client's family and try to figure out what's going on and how to move forward with it. A lot of these psychiatric wards have programs that kind of help to transition when you're home as to what to do next, if you're going to find a therapist, if you're going to residential or day treatment, and what that's going to look like for you. This is a good place to go if your child or a loved one isn't safe at home. This gives you a chance to have them in a safe place and let things calm down while you try and figure something out. And again, this isn't a long-term treatment option. And that's where day treatment comes in. Day treatment is kind of in the same kind of area as the inpatient, but you go home at night. So in the morning you wake up and you go there. You attend, some kind of the school that they have set up there. All of these have, except for inpatient. Inpatient doesn't have this, but day programs have an accredited high school or elementary school, middle school in them so that your children can get school credit while also doing the things that they need. So they go to school, and then after school they will meet with therapists and have groups and different kind of processing. You'll have family therapy at least once a week, and just kind of in this area where they can be productive, and then they come home at night. They spend the night so they can be at home and be integrated in the family environment, and hopefully throughout that time they can learn the coping skills they need until they don't have to be at the day treatment the entire day, but they can begin to meet with a therapist maybe multiple times a week, and then to once a week, in times where they can become stable. And then the third kind that I want to spend a little bit more time on is residential treatment. The residential treatment centers kind of vary. They're all across the country, and they kind of have their own little approach to things, but ultimately residential treatment center, your child, your adolescent will be there 100% of the time. So they will attend school there. Again, they all are accredited high school, middle school, elementary schools, and they will be provided not only with an education but with therapy, individual therapy as well as family therapy and group work. This is a cool atmosphere to be in because people around the same age who are dealing with similar things are able to get advice from each other and empathize with each other. There are also staff members there that are trained to know what to do, and coupled with a therapist and a psychiatrist who is also on board, as well as often a nutritionist and someone to make sure that things are running smoothly in the house and making sure that it's a safe environment. The people in treatment are given the most structure that they can to provide a safe place. And with this, they have every opportunity to succeed. The one thing that's hard with this is that the parents aren't with their children when they're in residential treatment. But residential treatment often does a good job of including family in the healing process. So allowing weekends with the children, or overnight visits and things like that, to really just implement that structure back into the life of the family, and they have family therapy and things like that. So while it's a little bit hard, it ends up being okay. And a lot of these residential treatment centers have transition programs. So different kind of level systems, they all seem to have some kind of way to level up until you're at a point where you are stable enough, where you have enough trust, your relationship with your family is stable enough that you can start to transition home, that you can start going to a home high school, or hang out with your friends more, begin to do the things that you were doing before you went to treatment. And the way that they do that is through progressive steps. So you're not all of a sudden in this one place and then plopped back at home. There's a transitional process, which is really good, and it's helpful for parents and for the adolescent to try and transition back. So these are just a couple different ways that residential treatment, inpatient, and day treatment can help benefit. And if that gets to the case, if your child or adolescent is at the case where you are thinking that they need some form of extended treatment aside from weekly therapy, I would encourage you to learn more about this. There are different sources that you can go to. There are education consultants, and there are local sources. A lot of therapists will know these things, and I would just recommend doing the research and finding what's best for your child in these options. So the next lesson, we're going to talk about financial things when it comes to therapy. A lot of times it gets really expensive, and especially when it comes to these inpatient kind of opportunities. So we're going to discuss a little bit how to go about navigating that and what to do when you don't know where to go for more resources in that. And I look forward to talking to you guys more in the next lesson. Thank you.